Good morning, Doc Scenario. Today, we will discuss alcohol-related disorders. Alcohol is one of the most commonly abused substances worldwide, and its misuse can lead to significant medical, psychological, and social consequences. What are the major categories of alcohol-related disorders?
Good morning, Dr. Tony. The major categories of alcohol-related disorders include 1. Alcohol use disorder, 2. Alcohol intoxication, 3. Alcohol withdrawal, 4. Other alcohol-induced disorders.
Excellent. Let us begin with alcohol use disorder. How would you define it?
Alcohol use disorder is a medical condition characterized by an impaired ability to stop or control alcohol consumption despite experiencing negative social, occupational, or health consequences. The disorder must persist for at least 12 months for a diagnosis to be made.
That is correct. What are the signs and symptoms of alcohol use disorder?
The signs and symptoms include consuming alcohol in larger amounts or for a longer period than intended, unsuccessful attempts to cut down or control alcohol use, spending significant time obtaining alcohol or recovering from its effects, strong cravings or an urge to consume alcohol, continued alcohol use despite persistent social or interpersonal problems, giving up social, occupational, or recreational activities due to alcohol use.
Well done. It is important to distinguish alcohol use disorder from other conditions. Can you list some of the differential diagnoses?
Yes, the differential diagnoses include conduct disorder in childhood, oppositional defiant disorder in children, antisocial personality disorder, sedative, hypnotic, or anxiolytic use disorder, non-pathological use of alcohol.
Good. What investigations would you request for a patient suspected of having alcohol use disorder?
The recommended investigations include full blood count to assess for anemia or infection, drugs of abuse panel DOA6 to screen for substance use, breathalyzer to measure alcohol levels in exhaled breath, liver function tests to check for alcohol-induced liver damage, kidney function tests to assess renal function, thyroid function tests T3, T4 to rule out thyroid disorders that may mimic alcohol-related symptoms. Alcohol use disorders identification test audit, a screening tool for alcohol use. CAGE questionnaire, a simple screening tool for alcohol dependence. Human immunodeficiency virus HIV and rapid plasma reagent RPR to screen for sexually transmitted infections. Hepatitis B screening to check for liver infections related to alcohol use.
Excellent work, Doc Scenario. Now, let us move to alcohol intoxication. How would you describe this condition?
Alcohol intoxication is a condition where a person experiences clinically significant behavioral or psychological changes due to recent alcohol consumption. These changes may include inappropriate sexual or aggressive behaviors, mood instability, and impaired judgment.
Very good. How can we distinguish alcohol intoxication from sedative, hypnotic, or anxiolytic intoxication?
Alcohol intoxication can be distinguished by the smell of alcohol on the breath. However, other symptoms may be similar to those seen in sedative, hypnotic, or anxiolytic intoxication.
That is correct. What are the signs and symptoms of alcohol intoxication?
The signs and symptoms include slurred speech, incoordination, unsteady gait, nystagmus, involuntary eye movements, impairment in attention and memory, stupor or coma in severe cases.
Good. What differential diagnoses should be considered when evaluating alcohol intoxication?
The differential diagnoses include delirium, sedative or hypnotic intoxication such as benzodiazepines or barbiturates, bipolar I mood disorder, intoxication from other substances such as cannabis, cocaine, or lysergic acid diethylamide LSD.
Well done. What investigations should be performed for a patient with suspected alcohol intoxication?
The investigations include blood alcohol content BAC to measure alcohol levels in the blood, drugs of abuse panel DOA6 to check for the presence of other substances, alcohol use disorders identification test audit and CAGE questionnaire to assess alcohol dependence, breathalyzer test to estimate blood alcohol levels, random blood sugar RBS to rule out hypoglycemia, liver function tests to check for liver damage, kidney function tests to assess renal function.
Excellent. Now, let us move on to treatment. What pharmacological treatment options are available for alcohol intoxication?
The pharmacological treatment includes 1. Thiamine supplementation, 100 mg to 400 mg orally, intravenously, or intramuscularly, twice daily for up to 1 month. Alternatively, a multivitamin supplement containing at least 100 mg of thiamine can be given for up to 1 month. 2. Oxygen therapy, if necessary, to prevent unconsciousness. 3. Intravenous fluids, to prevent dehydration. If the patient is able to drink fluids comfortably, oral hydration is preferred.
Good. Are there any non-pharmacological treatments?
Yes, nutritional therapy is important to prevent hypoglycemia and to address potential malnutrition in certain patients.
Well done. Now, let us discuss the complications of alcohol use disorder. Can you categorize them?
Yes, the complications of alcohol use disorder can be classified into 1. Physical complications, pellagra, vitamin B3 deficiency, alcohol-induced hepatitis, neuropathy, fatty liver disease, alcohol-induced seizure disorder, cardiovascular diseases. 2. Social complications, loss of employment, unplanned pregnancies, legal issues, relationship or marital problems, problems with school authorities, family dysfunction. 3. Psychological complications, depression, Wernicke-Korsakoff syndrome, alcohol-induced psychosis, alcohol-induced mood disorder.
Excellent, Doxinario. You have provided a comprehensive overview of alcohol use disorder and alcohol intoxication. We will continue with alcohol withdrawal and other alcohol-induced disorders in our next discussion.